So the next checklist is preoperative care, and we'll be covering preoperative care and postoperative care checklists in this particular Camtasia. So you're required to perform nursing interventions for one person that's undergoing a surgical procedure whilst you're on placement. And you can see here that one person, you can have 2 attempts at caring for 2 different people, but you need to be deemed satisfactory on the second attempt. We ask that you are responsible for this person and preparing them. It might be the day of theatre or the day of their medical intervention. It might be something that's been done down in medical imaging, for example, or it could be that they're going to day stay or to theatre for either a major, minor or a surgical intervention of some description. We ask that you are quite involved in their preparation for theatre, making sure that they understand what's required, what's going to be happening, that you've completed all the necessary paperwork, that they have a consent form, that you've identified all their, what's happening with their valuables, as well as things like were they fasting, do they need to fast, is there medications that need to be withheld, those kinds of things. We ask that you're looking at any patient that's going for a surgical procedure that has, for example, a wound, or is having an incision, or has had a puncture as a result of some sort of intervention or investigation. So that is the preoperative requirements there. And we also, as usual, you'll be getting some feedback from your supervisor and you'll be writing a response. Based on the feedback that you receive here, we want you to, just on the second part here, explain how that, what that feedback meant to you and what you'd perhaps do differently next time based on the feedback that you received. The top section here is if you can just describe what was specifically different about preoperative preparation for that patient. What did you do that was a bit abnormal to the usual daily routine that you would be caring for someone? So we want you to complete the reflection, and then again, this is the post-operative checklist. So performing nursing intervention for one person that's undergoing surgical procedure in the workplace post-operatively. So caring for them when they return to the ward, making sure that you've prepared the environment, that you've got everything that they need for when they return after their procedure. And then, of course, that you do all the monitoring, assessment, identifying any changes, whether there's been an improvement or a deterioration in their condition, is there any bleeding at the wound, that kind of thing. So we want you to be really thinking about how that you would be looking after that person in that post-operative environment. We also have down here it says what provides wound care as necessary, depending on the situation, what they've had done, and as well as informing and teaching them. Same applies here when it comes to the supervisor feedback and student feedback. You will be required to describe what was different in the post-operative care than normal care, as well as the feedback you received and how you took that on board and perhaps what you might do differently next time.